Hey, what's up? It's Nico. Here to talk about a little bit more of post-op and more about what exactly I packed for basically what I needed for post-op. But a tip before I forget, they really didn't make me prep too much when I was going in for my surgery. So with that being kind of said, I mean, Satterwhite didn't really use any drains or anything like that. Um, So as far as actually preparing for the surgery, it's basically all like mental, I think. But the tip is, if you have a lot of armpit hair, I suggest you shave it off, because only the fact that you're not going to be able to shower for a week, it tends to make it kind of more sweatier, and you'll just appreciate it a lot more if you did. And not only that, with wearing the wrap and with the tape or whatever's gonna be around on your torso and stuff, like everything's sticky and just. I would have shaved my armpits beforehand, just because it's just so much better. I feel like it'd be so much better for you. But besides that, gonna head into some stuff that I actually did get that I actually needed. Um, so first off, the first stuff that I actually tried to purchase, which I think I have showed before, was basically just some t-shirts, like some button-up tees, um, the best, so that way you're not struggling so much. Um, the one thing I did buy that I was consistently using every day, that I'm pretty happy that I did end up buying, is one of these pillows right here. One of these will basically do the job, like, especially if you have to sleep on your back like 24/7. I know it's, like I said, 2 weeks and I'm still having to sleep on my back. I can, as of maybe a couple days ago, was able to kind of sleep on my sides a little bit, but not for too long. Like, after a while, I'd feel like it'd be cramping up and it'd be sore. But yeah. And then some other stuff for sure that I'm happy I picked up is hand sanitizer. When you're always cleaning your stuff, um, or yourself, or majority of the time during the week after your surgery, you're just gonna be pretty much laying down. Like, I remember getting up right after my surgery, like, just to wash up and stuff, and I was already tired. So you're not gonna really have a lot of energy to do too many things and stuff, like keeping yourself clean or your hands clean and whatnot. Um, that for sure. And then something else I did buy, I bought too much of though, were some of these wipes. I think these are some traveling ones. I think they like come like 20 wipes a package. I ended up buying 3 of them. The week that I was the week after surgery, I only used one of these. So, like, I don't even think I opened up another one yet, or I haven't needed to, because then I started showering. So, like I said, like, now this is just pretty much extra stuff. Being overwhelmed and worried too much. I'm trying to get what I need and get extra stuff, but we're trying to prevent that for you guys. Um, let's see what else. This I had from a second job, basically melatonin, which is, it basically helps you sleep. I always had insomnia, so I always just naturally would take these only if necessary. Um, but what I avoided needing to take this, because I was taking Benadryl, because of the fact that when everything's healing, like, it tends to get really itchy like a tattoo. So instead of taking the melatonin, which would help me sleep, I'd just take a Benadryl, which would naturally, make you drowsy and sleepy, and then plus it help with the itchiness. Um, the the surgery spot gave me an ice pack that I actually was using for my chest every day. Which I'm happy they did, because I didn't know they would, and it was cool because all I needed to do was put ice inside of it, and then I could like refill it, over and over or whatnot. Um, yeah, so maybe that's something you'd want to purchase, is like an ice pack or something, for sure, because I use that every day. Um, when I wasn't taking those narcos that were making me constipated, and I did switch over to some regular like pain relievers. These are 500 milligrams. I was taking 2 of them. Just because sometimes the narcos, like for me, the first night I took them and I took the 2 doses like they wanted, I ended up throwing up in the end, and I wasn't even really even eating that much at that time, so that sucked. But I was pretty much doing these and then the narco if necessary. With the amount of pain I had to go through, I went through unnecessary pain because of the fact I had the binder wrapped too tight. So I'm thinking, if I didn't have that pain-wise and everything, I think I would have been totally fine. But, that's just for me and my, tolerance and whatnot. Other stuff you're going to need, for sure, Q-tips, because that's what you're going to be using for your nipples. Or for whatever you need to clean. Sometimes direct contact's not the best, so, Q-tips will be the best. Aftercare, some gauze pads for sure, which I use over my nipples, change them out every day. Your surgeon or whoever will pretty much give you more instructions as to how to take care of it, stuff like that. I did need to buy more like surgical tape for the gauze, to put over my nipples. And then of course some bacitracin, ophthalmic ointment. Some I don't know if you can really see that, but it's basically just like healing cream. Yeah, they had given me some, and then they said that you could just buy extra at the store if you needed to. So besides like that stuff, I really didn't need anything else. I bought straws because a lot of videos suggested straws. I was fine without them. Travel pillow I actually bought, but ended up ripping on the way back home, which was stupid. But like I said, other than that, like, you should be fine. If you have any questions, feel free to comment. But yeah, overall experience, freaking awesome, and still getting used to it, I guess. And it feels nice that I do feel like I have more recognition, especially in my family, because my mom did take care of me for a week. That's the most I ever heard her call me by my name, that I picked, and the pronouns, that meant the world to me. So yeah, and everyone that's waiting for their top surgery date or whatever, like, the patience, like, it'll be so worth it. Just patience. And I'm the most impatient person, so I know that, easier said than done type of thing, but patience, man. Yeah. Alright, everybody enjoy, and talk to you guys later.